Laxatives. Before talking about laxatives, let's quickly explain what constipation is. Constipation isn't just about skipping a day or two without going to the bathroom. It's when you pass hard stools or find yourself going less frequently than your usual pattern. Sound familiar? If so, don't worry, you're not alone, and there are ways to tackle it. Constipation, we've all been there, that uncomfortable feeling of bloating and sluggishness when things just aren't moving. But there's one word that often pops up as the solution: laxatives. Today, we're diving into what laxatives are, how they work, and the different types you should know about. So, what are laxatives? Laxatives, also called purgatives or aperients, are substances that help loosen stools and increase bowel movements. They're commonly used to treat and prevent constipation, giving your digestive system that extra nudge it sometimes needs. But before we talk about how they work, let's understand constipation itself. Okay, let's now know about the 4 types of laxatives. 1. Bulk laxatives, bulk-forming laxatives. 2. Osmotic laxatives. 3. Faecal softeners. 4. Stimulant laxatives. Now let's talk about these 4 different types of laxatives. Each type works differently, and knowing which one to use can make a big difference. First up, we have bulk-forming laxatives. All right, friends, let's break down one of the most natural ways to get things moving: bulk-forming laxatives. These are basically the MVPs of the fiber world, indigestible vegetable fibers that work wonders for your digestive system. Here's how they do their magic. Bulk laxatives increase the water content and bulk of your stool. Think of it like fluffing up a pillow. It makes everything softer and easier to pass. But there's one golden rule when taking fiber supplements: stay hydrated. Drinking plenty of water is crucial to avoid bloating, flatulence, or even blockages. So what can you use? Let's start with the classic bran, unprocessed and simple. You can mix it into your meals and pair it with a full glass of water. Easy, right? Now, if you're looking for soluble fiber options, you've got a few superstar names. Ispagula husk, you might know it as Fibogel, psyllium husk, methyl cellulose, and sterculia. These work best when you're drinking lots of fluids. About 2 liters a day is the sweet spot. Just remember, these aren't instant fixes. They usually take 2 to 3 days to kick in, so a little patience goes a long way. Bulk laxatives are perfect for keeping things regular, but like everything, moderation is key. Stay hydrated, keep your fiber intake balanced, and let nature do its thing. Side effects: flatulence, abdominal bloating. Yep, you might feel a little gassy or bloated at first, but don't worry, your body usually adjusts over time. Now let's talk about who can benefit from bulk laxatives. They're especially helpful for people managing conditions like colostomy, ileostomy, hemorrhoids, irritable bowel syndrome, IBS, and drug-induced constipation. Let's know a little about this. Colostomy. A colostomy is a surgical procedure that helps people manage certain digestive issues. Here's how it works. One end of the large intestine, or colon, is brought out through an opening in the abdominal wall. This opening is called a stoma. Cool, right? Let me show you how it helps. During the procedure, the colon is carefully diverted to create the stoma. Afterward, people who have a colostomy use special pouches attached to their abdomen. These pouches collect waste, making it easy to manage and dispose of. Some colostomies are temporary, while others are long-term. It depends on the individual's health needs. Now, you might wonder, why would someone need a colostomy? Great question. Sometimes the body has trouble passing stools naturally, which can happen due to illness, injury, or other issues with the digestive system. A colostomy offers a safe and effective way to restore balance and improve quality of life, so patients often use bulk laxatives to keep things moving and avoid complications. Ileostomy. So what exactly is an ileostomy? Great question. An ileostomy is a type of surgery where doctors create a small opening called a stoma. This stoma allows waste and gas to leave your body without passing through the colon or rectum. Think of it as a helpful detour for your digestive system. There are 2 main reasons someone might need an ileostomy. First, it could be temporary, giving the colon or rectum some time to heal after surgery. Or it might be permanent, especially if those parts of the digestive system aren't working properly anymore. Again, bulk laxatives can come to the rescue for smoother waste management. So, what are hemorrhoids? Well, they're swollen veins in the lower rectum. Let's break it down. Internal hemorrhoids, usually painless but can bleed. External hemorrhoids. These can be painful and a bit more troublesome. Now, you might hear them called piles, but no matter the name, they're something many people deal with. So what can you do if you're dealing with hemorrhoids? Let's talk treatment and prevention. Eat high-fiber foods, use topical treatments, soak in warm baths, and take oral pain relievers. Now let's go back to our lesson. You remember the 4 types of laxatives. So let's talk about the second type. Osmotic laxatives. So what's the deal with osmotic laxatives? These little wonders work by drawing water into your large intestine. Think of them as hydration heroes for your gut. By increasing the water content, they soften things up, making it easier to, well, go with the flow. And guess what? They're minimally absorbed from the gut, so their effects stay right where they're needed. Now, let's shine the spotlight on one superstar osmotic laxative, Lactulose. If you're dealing with chronic constipation or even a condition called hepatic encephalopathy, fancy term for liver-related brain fog, Lactulose is your go-to remedy. It's available as a simple solution, so no complicated instructions here. Just dose and go. Of course, no hero is perfect. Lactulose can sometimes bring along a couple of sidekicks, flatulence, some extra gas, and a bit of abdominal discomfort. But hey, it's a small price to pay for relief, right? Who should avoid lactulose? Hold up though. Lactulose isn't for everyone. If you have an intestinal obstruction or if you're lactose intolerant, it's best to steer clear. Always check with your doctor first. It's better to be safe than sorry. You found a new word here, hepatic encephalopathy. So let's learn a little about it. What is hepatic encephalopathy? Hepatic encephalopathy, or HE for short, is a condition where brain function declines due to severe liver disease. Let's think of the liver as the body's detox center. Its job is to filter out harmful substances, including toxins, from your blood. But in hepatic encephalopathy, the liver's detox duties are compromised. This means toxins, like ammonia, start to build up in the bloodstream. When these toxins reach the brain, they can cause confusion, memory issues, and even more serious symptoms if untreated. Okay, so what's the deal with lactulose and hepatic encephalopathy? First off, hepatic encephalopathy is a condition that can occur in people with liver disease. It messes with your brain function, making you feel confused, forgetful, or even super drowsy. But fear not, this is where lactulose comes to the rescue. Lactulose is like the superhero of the laxative world. It doesn't just get things moving in your gut, it actually helps improve mental status too. Pretty cool, right? But how does it work? Here's the science. When the liver is damaged, it can't properly filter out toxins like ammonia. This buildup of ammonia in the blood is one of the main reasons for those mental foggy moments. Lactulose steps in as a colonic acidifier. In simple terms, it changes the environment in your gut, pulling that excess ammonia from the blood into the colon. From there, your body says, "See ya," as it's flushed out. Now let's be clear, lactulose doesn't cure liver disease or hepatic encephalopathy, but it can seriously help reduce symptoms and improve mental clarity. Think of it as your trusty sidekick in managing the condition. Okay, let's look at other types of medicines in our osmotic laxatives. First up, let's talk about macrogalls, also known as polyethylene glycol. Sounds super sciencey, but it's really just a hero for dealing with chronic constipation. If you've been struggling to stay regular, this could be your new best friend. Now, like any hero, macrogalls come with a few sidekicks you might not love. Abdominal discomfort, ugh. Nausea, we've all been there. Bloating and flatulence, don't worry, it's totally normal. And let's not forget dehydration, so stay hydrated, folks. Seriously, drink up. Water is your best ally here. But here's the catch. Macrogalls aren't for everyone. If you have an intestinal obstruction or a severe inflammatory condition of the intestinal tract, steer clear and consult your doctor. Now, let's move on to sodium acid phosphate. This one's your go-to when you need a clean sweep before surgery or an endoscopy. It's like spring cleaning for your intestines. Quick and effective. Sodium acid phosphate comes in various forms: oral solutions, enemas, and suppositories. Choose what works best for you depending on your needs and, comfort level. But heads up, it's not for everyone. If you're dealing with severe dehydration, this one's off the table. Always check in with your healthcare provider to make sure it's the right fit for you. Okay, now let's talk about the third form of laxatives. Faecal softeners. So what exactly are fecal softeners? Simply put, they're a type of laxative that helps make your stool softer and easier to pass. Think of them as the gentle helpers in your digestive system, keeping things moving along without too much drama. One popular fecal softener is liquid paraffin. It works by coating the stool and trapping water in it, which makes passing it a lot easier. Pretty cool, right? But hold on. Like with any medication, there are a few things to keep in mind. Liquid paraffin can interfere with your body's absorption of fat-soluble vitamins like vitamins A, D, E, and K. These vitamins are super important for your vision, bones, and overall health. Also, avoid prolonged use of liquid paraffin. Over time, it could cause more harm than good. Short-term relief? Yes. Long-term solution? Not so much. And here's a big one. Never give fecal softeners to children under 3 years old. Their tiny systems aren't ready for it, and it could lead to complications. Always consult a healthcare professional when it comes to kids. Here we're going to talk about our last form of laxatives, stimulant laxatives. So what makes stimulant laxatives special? They're like a gentle nudge for your intestines. These guys directly stimulate your enteric nervous system, boosting gut motility and secretions. Translation, they help speed things up in your digestive tract. Now let's break it down and look at two of the most common stimulant laxatives, Bisacidal and Senna. First up, Bisacidal. It's a fast-acting lifesaver for tackling constipation, prepping for bowel exams, or surgery. Need a clean slate for that colonoscopy? Bisacidal's got your back. But like all meds, Bisacidal has some potential side effects. Abdominal pain, nausea, rarely vomiting. You can take Bisacidal in tablets, suppositories, or enemas. So you've got options depending on what works best for you. Next is Senna, which comes from a plant. It's a natural solution for constipation, irritable bowel disease, IBD, recovery from anal or rectal surgery, easing hemorrhoid symptoms. Senna's great, but watch out for these side effects: abdominal pain, nausea, vomiting. One important thing, using too many stimulant laxatives like Senna or Bisacidal can lead to diarrhea and low potassium levels. So moderation is key. Oh, and let's not forget glycerol, another stimulant laxative commonly found in suppositories. Quick, simple, and effective. And there you have it. Stimulant laxatives are a helpful tool when nature needs a little push. But remember, they're not for everyday use. If you're dealing with frequent constipation, talk to your doctor. If you found this video helpful, give it a thumbs up, subscribe, and share. Leave a comment below with your thoughts or questions. I'd love to hear from you. Thanks for watching, and see you next time.